Silent bone thief. Why osteoporosis could kill you before cancer does. Every 30 seconds, someone breaks a bone due to osteoporosis. Every 12 seconds, it's a hip fracture. And here's what will terrify you. 20% of people who break their hip will die within 1 year. Not from the fracture itself, but from the cascade of complications that follow. If you think osteoporosis is just about weak bones, you're dangerously wrong. This silent disease kills more women than breast, ovarian, and cervical cancer combined. And men, you're not safe either. 1 in 4 men over 50 will break a bone due to osteoporosis. But here's the most frightening fact. Right now, while you're watching this video, your bones might be dissolving. Literally dissolving. And you have no idea it's happening because osteoporosis doesn't hurt until it destroys your life. Welcome back to Life Pulse, where we tackle the health threats that could change your life forever. Today we're exposing the bone disease that's literally stealing your skeleton while you sleep. 54 million Americans have osteoporosis or low bone density, but most don't know it until they break a bone doing something as simple as sneezing, hugging a grandchild, or stepping off a curb. The medical community calls it the silent thief because it steals your bone density without warning, then strikes with devastating force. Before we dive in, I need you to do something. If you're over 50, or if you know someone who is, hit that like button and share this video. The information I'm about to share could prevent a life-changing fracture. Statistics show that someone watching this video right now will suffer an osteoporotic fracture in the next 5 years, unless they act on what they're about to learn. Here's something your doctor probably hasn't told you. Osteoporosis is completely preventable and largely reversible. But the window of opportunity is closing every single day you delay action. Let me start with statistics that should shake you to your core. The death toll. According to the National Osteoporosis Foundation, osteoporosis causes 2 million VAMP fractures annually in the United States. The mortality rate following hip fractures is staggering. 20% die within 1 year. 50% never regain full independence. 25% require long-term nursing home care. 40% cannot walk independently. 60% require assistance with daily activities. But here's what's truly horrifying. Most of these deaths aren't from the fracture itself. They're from blood clots, pneumonia, and infections that occur because the person becomes bedridden. The hidden epidemic. Dr. Susan Greenspan from the University of Pittsburgh explains it perfectly. Osteoporosis is a pediatric disease with geriatric consequences. Your peak bone mass is built by age 30, and after age 35, you lose 1% of your bone density every year. After menopause, women can lose up to 20% of their bone density in just 5 to 7 years. The economic devastation. Osteoporotic fractures cost the healthcare system $19 billion annually, but the personal cost is immeasurable. Independence, mobility, confidence, and often life itself. The average cost of a hip fracture is $81,000 in the first year alone. The gender shock. While 80% of osteoporosis patients are women, men face a deadlier reality. When men break their hip, they're twice as likely to die within a year compared to women. Yet most men never get tested because they think osteoporosis is a woman's disease. The global crisis. Worldwide, osteoporosis causes 8.9 million fractures annually. That's 1 every 3 seconds. By 2050, hip fractures are expected to increase by 310% in men and 240% in women as the population ages. The cascade effect. Dr. Steven Bouden from Belgium explains, one fracture leads to another. After your first vertebral fracture, your risk of another fracture increases by 500%. It's like a domino effect. Once it starts, it's hard to stop. Let me tell you about Dorothy, a vibrant 72-year-old who contacted me last year. She said, I was putting groceries in my car when I felt a sharp pain in my back. I thought I pulled a muscle, but the ER doctor told me I had compressed 3 vertebrae just from lifting a gallon of milk. I had no idea my bones were so fragile. Dorothy's story is terrifyingly common. She had lost 3 inches of height over 10 years, but attributed it to normal aging. She had occasional back pain, but thought it was arthritis. No one, not her primary doctor, not her gynecologist, had ever mentioned bone density testing. How osteoporosis steals your skeleton. Your bones are living tissue, constantly breaking down and rebuilding. Think of it like renovation. Old bone is removed, resorption, and new bone is built to replace it, formation. In healthy people, this process is balanced. But with osteoporosis, the demolition crew, osteoclasts, works overtime while the construction crew, osteoblasts, slows down. The microscopic destruction. Dr. Clifford Rosen from Maine Medical Center describes it. Under a microscope, healthy bone looks like a strong honeycomb structure. Osteoporotic bone looks like Swiss cheese, full of holes and incredibly fragile. The bone density timeline: ages 0 to 30, building peak bone mass; ages 30 to 35, peak bone mass achieved; ages 35 to 50, gradual bone loss begins, 1% per year; menopause, accelerated bone loss up to 3 to 5% per year; postmenopause, continued bone loss 1 to 2% per year. The progressive danger zones: stage 1, osteopenia, bone density is lower than normal but not yet osteoporosis, T-score 1.2-2.5. Stage 2, mild osteoporosis, significant bone loss begins, T-score below 2.5. Stage 3, established osteoporosis, first fracture occurs. Stage 4, severe osteoporosis, multiple fractures, disability, loss of independence. Martha, 68, told me, "I sneezed and broke 3 ribs. The doctor said my bones were so weak that normal daily activities had become dangerous. I was terrified to move. I became a prisoner in my own body." The domino effect of fractures: wrist fractures, often the first warning sign, usually from trying to break a fall. Vertebral fractures can occur from coughing, sneezing, or bending forward. Hip fractures, the most dangerous, often requiring surgery and lengthy recovery. Rib fractures can occur from hugging, lifting light objects, or turning in bed. The psychological impact. Dr. Christine Ensrud from the University of Minnesota found that people with osteoporotic fractures experience 340% higher rates of depression, 280% higher rates of anxiety, 450% higher rates of social isolation, significant loss of self-confidence and independence. These could be your bones crying for help. Physical warning signs: loss of height, more than 1.5 inches could indicate vertebral fractures. Stooped posture, developing a hump, kyphosis from spinal compression. Back pain, especially sudden, severe pain that doesn't improve. Fractures from minor falls, breaking bones from falls from standing height. Tooth loss or gum disease, your jaw bones can also be affected. Weak grip strength, studies show this correlates with overall bone health. Brittle fingernails can indicate mineral deficiencies affecting bones. Lifestyle red flags: family history, genetics account for 60 to 80% of peak bone mass. Early menopause, before age 45, especially surgical menopause. Long-term steroid use, even nasal sprays can affect bones with prolonged use. Smoking accelerates bone loss and impairs calcium absorption. Excessive alcohol, more than 2 drinks daily, increases fracture risk. Sedentary lifestyle, use it or lose it, applies to bones. Eating disorders, history of anorexia or bulimia significantly impacts bone health. Medical risk factors: thyroid disorders, both overactive and underactive thyroid affect bones. Rheumatoid arthritis, chronic inflammation damages bones. Celiac disease impairs nutrient absorption. Cancer treatments, chemotherapy and hormone blockers accelerate bone loss. Certain medications, proton pump inhibitors, antidepressants, blood thinners. The hidden medication dangers: proton pump inhibitors, PPIs, used for acid reflux, they block calcium absorption. Antidepressants, SSRIs, can increase fracture risk by 40%. Anticonvulsants interfere with vitamin D metabolism. Diabetes medications, some types increase fracture risk. Cancer hormone therapies dramatically accelerate bone loss. The dangerous misconceptions: I drink milk so my bones are fine. Calcium alone isn't enough. I'm not that old yet. Bone loss starts in your 30s. Men don't get osteoporosis. 1 in 4 men over 50 will fracture. I feel fine, so my bones must be okay. Osteoporosis is silent until you fracture. Osteoporosis is just part of aging. It's preventable and treatable. James, a 67-year-old former construction worker, said, "I thought my strong muscles meant strong bones. When I broke my wrist just stepping out of my truck, I learned that muscle strength and bone strength are completely different things. The doctor told me I had the bone density of an 85-year-old woman." The dietary disaster. Many people unknowingly consume bone-destroying foods daily. Excessive caffeine, more than 4 cups of coffee daily, increases calcium loss. High sodium. Each 2,300 milligrams of sodium causes 40 milligrams of calcium loss. Excessive protein, more than 2 grams per kilogram body weight, can acidify blood. Soft drinks. Phosphoric acid interferes with calcium absorption. Alcohol. Even moderate consumption affects bone formation. DEXA scan, the gold standard. Dual energy X-ray absorptiometry measures bone density at your hip and spine, the most fracture-prone areas. It's painless, takes 10 to 15 minutes, and uses less radiation than a chest X-ray. Understanding your T-score. Above 9 is 1.0, normal bone density. Minus 1.0 to -2.5, osteopenia, low bone density. Below -2.5, osteoporosis. Below 9 to 2.5 with fracture, severe osteoporosis. Understanding your Z-score. Compares your bone density to others your age. A Z-score below 2.0 suggests secondary causes of bone loss that need investigation. Home testing revolution. New ultrasound devices can screen for bone density at your heel or wrist. While not as comprehensive as DEXA, they're excellent screening tools and cost under $200. The Frax Calculator. This online tool calculates your 10-year fracture risk based on risk factors. It's revolutionizing how doctors assess fracture risk beyond just bone density. Factors include age and gender, weight and height, previous fractures, family history, smoking and alcohol use, medical conditions, medication use. Advanced testing options. Trabecular Bone Score (TBS) analyzes bone texture and quality, not just density. Vertebral Fracture Assessment (VFA) detects silent spine fractures. CT scans provide 3D bone analysis. Bone turnover markers, blood tests that measure bone breakdown and formation. When to get tested. All women over 65, all men over 70, anyone over 50 with risk factors, anyone who's had a fracture after age 50, anyone on medications that affect bones, people with diseases that affect bone health. Insurance coverage. Medicare and most insurance plans cover bone density testing every 2 years for at-risk individuals. The test typically costs $300 to $500 but is often fully covered. The testing controversy. Some experts argue that current guidelines miss many at-risk individuals. Dr. John Canis, who developed the Frax tool, advocates for earlier and more frequent testing based on individual risk factors. The Bone Biology Deep Dive. The molecular level. Understanding how bones work helps you protect them better. Bones are composed of 65% minerals, primarily calcium phosphate hydroxyapatite crystals, 25% organic matrix, mostly collagen protein, 10% water, essential for bone flexibility. The bone remodeling cycle. 1. Activation phase, signals trigger bone remodeling. 2. Resorption phase, osteoclasts dissolve old bone, takes 2 to 3 weeks. 3. Formation phase, osteoblasts build new bone, takes 2-3 months. 4. Mineralization phase, new bone hardens, takes 6 to 12 months. Hormonal control system, parathyroid hormone, PTH, increases calcium levels by breaking down bone. Calcitonin, decreases calcium levels by building bone. Estrogen, protects bones by slowing breakdown. Growth hormone, stimulates bone formation. Cortisol, high levels accelerate bone loss. The peak bone mass factor. Dr. Connie Weaver from Purdue University explains, peak bone mass is like putting money in the bank for retirement. The more you deposit by age 30, the more you have to withdraw later without going bankrupt. Genetic factors. Your genes determine 60 to 80% of your peak bone mass potential. How quickly you lose bone after menopause. Your fracture risk independent of bone density. How well you respond to treatments. Environmental factors. These can override genetic predisposition. Nutrition during childhood and adolescence. Physical activity patterns. Exposure to toxins and medications. Lifestyle choices. Smoking, alcohol, medical conditions and treatments. Prevention strategies that work. 16T. The bone building trinity. Calcium, vitamin D, and exercise. Calcium, the building block. Ages 1950, 1,000 milligrams daily. Women over 50, 200 milligrams daily. Men over 70, 1,200 milligrams daily. Calcium absorption facts. Your body can only absorb 500 milligrams at one time. Absorption decreases with age from 60% in youth to 20% in elderly. Vitamin D increases absorption by 400%. Magnesium is required for calcium utilization. Best calcium sources: dairy products, milk, 300 milligrams per cup, yogurt, 450 milligrams per cup, cheese, 200 milligrams per ounce. Leafy greens, kale 90 milligrams per cup, collard greens 2166 milligrams per cup, bok choy 158 milligrams per cup. Fish with bones, sardines, 325 mg per 3.5 oz, canned salmon, 181 mg per 3 oz, fortified foods, orange juice, 300 mg per cup, cereals, berries, tofu, 253 mg per half cup. Vitamin D, the calcium helper. Without adequate vitamin D, you only absorb 10 to 15% of dietary calcium. With sufficient vitamin D, absorption jumps to 30 to 40%. Vitamin D requirements: ages 19 to 70, 600 IU daily. Over 70, 800 IU daily. Therapeutic doses: 1,000 to 4,000 IUs daily for deficiency. Vitamin D sources: sunlight, 15 to 30 minutes of midday sun exposure. Fatty fish, salmon, mackerel, tuna. Fortified foods, milk, cereals, orange juice, supplements. D3, cholecalciferol is preferred over D2. Exercise, the bone builder. Weight-bearing and resistance exercises actually stimulate bone formation through mechanical loading. Dr. Miriam Nelson from Tufts University found that women who did strength training twice weekly increased their bone density by 1% per year, while control groups lost 1 to 2%. Best bone building exercises: weight-bearing activities, walking, hiking, stair climbing, dancing, tennis, basketball, jumping and hopping exercises, high-impact aerobics. Resistance training, weightlifting, free weights and machines, resistance bands, body weight exercises, push-ups, squats, functional movements, balance and flexibility. Yoga and Tai Chi reduce fall risk. Balance training, Pilates, stretching routines. The exercise prescription: the National Osteoporosis Foundation recommends 30 minutes of weight-bearing exercise most days, resistance training 2 to 3 times per week, balance exercises daily for those at fall risk, flexibility exercises 2 to 3 times per week. Sex story: Ruth, 74, increased her bone density by 8% in 2 years through a combination of calcium supplementation, vitamin D, and resistance training 3 times per week. I went from being afraid of falling to feeling confident and strong again, she said. Additional bone protective nutrients: vitamin K2 helps direct calcium to bones rather than arteries. Magnesium, required for bone mineralization, 400 to 20 milligrams daily. Phosphorus works with calcium, same amount as calcium. Vitamin C, needed for collagen formation, 75 to 90 milligrams daily. Building blocks for bone matrix, 1 to 1.2 grams per kilo body weight. Lifestyle modifications: quit smoking. Smoking reduces bone density by 10 to 20%. Limit alcohol, no more than 1 drink daily for women, 2 for men. Maintain healthy weight, both underweight and obesity increase fracture risk. Prevent falls, remove hazards, improve lighting, wear proper footwear. Manage chronic conditions: diabetes, thyroid disorders, arthritis. Medication options: bisphosphonates, the first-line treatment for most patients. Alendronate Fosamax, weekly oral tablet. Risdronate Actonel, weekly or monthly oral. Ibandronate Boniva, monthly oral or quarterly IV. Zoledronic acid, reclassed, annual IV infusion. Benefits: reduce fracture risk by 40 to 70%. Mechanism: slow bone breakdown by inhibiting osteoclasts. Side effects: rare but can include jaw problems and atypical fractures. Estrogen for women, most effective when started at menopause. Testosterone for men, for those with documented low levels. Selective estrogen receptor modulators, SERMs. Raloxifene provides bone benefits without breast uterine risks. Newer breakthrough treatments: denosumab, Prolia, injection every 6 months. Blocks rankle, a protein that activates bone breakdown. 68% reduction in spine fractures, 40% reduction in hip fractures. Reversible effects: bone loss resumes when stopped. Teriparatide Forteo, daily injection for up to 2 years. Only medication that actually builds new bone. Synthetic parathyroid hormone, 65% reduction in spine fractures, especially effective for severe osteoporosis. Dual action, builds bone while reducing breakdown. 73% reduction in spine fractures. Most potent bone-building medication available. Abaloparatide Tymlos, daily injection, similar to Forteo, may have fewer side effects, strong bone-building effects. Natural and complementary approaches: strontium supplements, may increase bone density but controversial due to cardiovascular risks. Vitamin K2 supplementation supports proper calcium utilization. Magnesium for calcium absorption, often deficient in older adults. Boron for hormone balance, supports vitamin D and hormone function. Silicon supplements may support bone matrix formation. The personalized medicine approach. Dr. Ethel Siras from Columbia University emphasizes, treatment must be individualized. What works for one person may not work for another. We now consider genetics, lifestyle, fracture risk, and patient preferences to create personalized treatment plans. Treatment duration debates. Drug holidays. Some patients can safely stop bisphosphonates after 3 to 5 years. Sequential therapy, using different medications in sequence for optimal results. Combination therapy, using multiple approaches simultaneously. Monitoring response, regular testing to ensure treatments are working. Patricia's remarkable recovery. At 68, Patricia had osteoporosis so severe her doctor feared she'd fracture just from normal activities. Her T-score was 93.2, putting her in the severe osteoporosis category. Through a combination of 4TO injections, vitamin D supplementation, and resistance training, her bone density improved by 12% in 18 months. I went from being afraid to pick up my grandson to playing tennis again. Patricia told me the 4TO injections were a daily reminder to take care of my bones, and the resistance training made me feel strong again. My latest DEXA scan showed my T-score improved to -of 2.1. I actually reversed my osteoporosis. The research validation. The study of osteoporotic fractures followed 9,704 women for over 20 years and found that comprehensive treatment programs resulted in 65% reduction in hip fractures, 89% reduction in spine fractures, 78% reduction in wrist fractures, significant improvement in quality of life scores, 45% reduction in mortality rates. Men's success too. Harold, 71, broke his shoulder in a minor fall and discovered severe osteoporosis. I was shocked, he said. I always thought this was a woman's disease. My T-score was 92.8 and my doctor said I was at very high risk for hip fracture. After 2 years of treatment with reclast, annual infusion, and resistance training, his bone density improved enough that his doctor reduced his fracture risk by 60%. I feel stronger now than I did 10 years ago, Harold reported. The family success story. When Maria, 58, was diagnosed with osteoporosis, her entire family got tested. Her 82-year-old mother had severe osteoporosis, her 32-year-old daughter had osteopenia, and even her 14-year-old granddaughter had low bone density. We made bone health a family priority. Maria explained. We all started taking calcium and vitamin D, we joined a gym together, and we changed our diet. 2 years later, everyone's bone density had improved. We probably prevented multiple fractures by acting as a family. The prevention success. Jennifer started bone health measures at age 45 when her mother suffered a hip fracture. Despite having multiple risk factors, early menopause, family history, small frame, she maintained normal bone density through menopause and beyond. I started resistance training, made sure I got enough calcium and vitamin D, and took hormone therapy during menopause, Jennifer said. At 65, my bone density is still normal. Prevention really works. The athletic recovery. Professional golfer Tom, 55, developed osteoporosis after taking steroid medications for chronic back pain. His bone density plummeted, and he feared his career was over. Through a combination of stopping the steroids, starting 4TO, and working with a sports nutritionist, I not only saved my career but improved my game, Tom said. Strong bones gave me the confidence to swing powerfully again. The devastating statistics. 95% of hip fractures are caused by falls. Every 20 minutes, an older adult dies from a fall-related injury. The total medical costs for falls exceed $50 billion annually. Home safety assessment. Remove tripping hazards, loose rugs, electrical cords, clutter, improve lighting, night lights, brighter bulbs, motion sensors, install safety features, grab bars, handrails, non-slip surfaces, secure loose items, make sure everything has a place. Vision and hearing. Regular eye exams. Poor vision doubles fall risk. Update prescriptions. Old glasses can be worse than no glasses. Remove visual obstructions, clean windows, replace dim bulbs. Hearing assessment. Balance problems often start with hearing issues. Medication management. Review all medications. Many increase fall risk. Blood pressure medications can cause dizziness. Sleep aids increase drowsiness and confusion. Multiple medications, interactions increase fall risk. Footwear and clothing. Proper footwear, supportive, non-slip shoes. Avoid high heels, even low heels increase fall risk. Appropriate clothing, avoid long robes or loose pants. Good fit, clothes that are too loose or tight affect movement. Exercise for fall prevention. Balance training, Tai Chi reduces falls by 45%. Strength training, strong legs prevent falls. Flexibility exercises, maintain range of motion. Reaction time training, video games can improve reflexes. Eleanor, 78, fell 6 times in 2 years before discovering a comprehensive fall prevention program. I was terrified to leave my house, she said. After completing the program, which included balance training, home modifications, medication review, and vision correction, she hasn't fallen in 3 years. Here's your bone-saving action plan. Step 1. Risk assessment. Take the FRAX assessment online right now at www.meshphone//sheffield.ac.uk/FRAX. It takes 2 minutes and gives you your personalized 10-year fracture risk. Step 2. Schedule testing. If you're over 65, women, or 70 men, or have risk factors, schedule a DEXA scan this week. Don't wait for your annual physical, call today. Step 3. Dietary audit. Track your calcium intake for 3 days using a food diary app. Most people get less than half of what they need. Identify the gaps and make a plan to fill them. Step 4. Vitamin D testing. Ask your doctor for a 25-hydroxy vitamin D blood test. Optimal levels are 30 to 50 nanograms per milliliters. If you're deficient, you'll need higher doses to catch up. Step 5. Exercise program. Start weight-bearing exercise immediately. Even walking 30 minutes daily can help maintain bone density. Add resistance training twice weekly. Step 6. Home safety audit. Walk through your home looking for fall hazards. Remove loose rugs, improve lighting, install grab bars where needed. Consider hiring a professional for a comprehensive assessment. Step 7. Medication review. List all medications and supplements you take. Research which ones might affect bone health. Discuss alternatives with your doctor if needed. Step 8. Family history investigation. Ask family members about fractures, height loss, and bone problems. This information is crucial for assessing your risk. Your bones are literally the foundation of your independence. Without strong bones, simple pleasures like playing with grandchildren, traveling, or just living in your own home become impossible. The choice is yours. Take action now while you can prevent fractures, or wait until you're lying in a hospital bed wondering why you didn't listen to the warning signs. Share your story in the comments. Have you been diagnosed with osteoporosis? What treatments are working for you? Are you taking steps to prevent bone loss? Have you had fractures that changed your life? Your experience could help someone else avoid a devastating fracture. Don't underestimate the power of sharing your story. Subscribe and hit that notification bell, because next week we're tackling a complication of diabetes that sends someone to the emergency room every 30 seconds. Diabetic foot problems and the daily inspection that could save your foot from amputation. Please share this video with anyone over 50. Osteoporosis prevention is the best gift you can give someone you love. Forward this to your parents, your siblings, your friends. You might literally save their life or their independence. Remember, your bones built your body and carried you through life. Now it's time to return the favor by taking care of them. Osteoporosis might be silent, but it doesn't have to be deadly. The good news is that bone health is largely within your control. With the right combination of nutrition, exercise, and medical care when needed, you can maintain strong bones well into your golden years. Don't wait for a fracture to pay attention to your bones. Every day you delay action, your bones get a little weaker. But every day you take positive steps, you're building a stronger foundation for your future. The technology exists, the treatments work, the knowledge is available. The only question is, will you choose to act? Your bones have carried you this far. Now carry them forward with the care they deserve. Remember, this information is for educational purposes only. Always consult with a healthcare professional for personal medical advice and treatment decisions.